My name is Dr. Rick Seguil.
And action. Hey, Jay had a... This is Kirk And action. Hey everyone, Joe had a question about the safety of e-cigarettes versus medical marijuana vaping. This is really a hot button topic at this point in time in September and even in August of 2019. But if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. So, I'm a primary care doctor out of Advocate at Sherman Hospital in Elgin, Illinois. Actually, my office is in Bartlett, but Advocate, the hospital, is in Elgin. And I'm probably one of the only doctors in the area that's certifying for medical cannabis. And I have had really good success with getting patients off of Norco and their pain relievers by switching them over to cannabis. Now the medical cannabis that we use, it varies depending on the patient. It's usually going to be edible or a tincture that you put on a tongue or a patch or a cream, and sometimes vape. I don't suggest smoking the flower. I know the flower is cheap to smoke like in a joint, a bowl or a device. But the problem is that you get way too many cannabinoids in the flower, and some people don't need all of them. I think the patients that I see, I just want to hit the targeted problems: sleep issues, post-traumatic stress disorder, and flare-up of anxiety or panic attack, chronic pain. So I believe that I have had good success with my patients. With low, if anything, side effects. I even use it in my 70-year-olds with good results. So the problem is that some of them will use the vape. And technically a vape is kind of like an e-cigarette. But so the objective is, with my patients, take away pain, have a level or blood level of CBD and a little bit of THC in the bloodstream at all times, so it will allow my patients to get through activities of daily living, physical therapy, or sleep properly without the opioids. Because let's face it, the opioid crisis in Illinois and throughout the United States was terrible. People dying of overdose. So I've contributed to reversing that, but now we have an issue with e-cigarettes. So if you look at the CDC's website, you probably can't see it's too bright, but check out cdc.gov, and then on the website do a search for vape or e-cigarette, and you'll see what pops up, the most recent declaration. And if you look at what has happened, at least 450 cases have been reported of some kind of respiratory problem. And the respiratory problem, because it had a common theme, e-cigarette use, has been reported. And with either the primary care offices or the emergency rooms or the pulmonary doctors, the lung doctors, when there's a little bit of an uptick in the same kind of symptoms and scenarios, CDC gets involved because it could be an endemic issue. So they'll investigate. Now, what really sparked it or triggered the CDC being involved even faster was the handful of deaths. The first one being in Illinois. So the deaths usually surround some kind of respiratory distress. That's shortness of breath, difficulty with activities of daily living, sometimes abnormal loss of weight, fatigue, GI disturbance. All those things can be attributed, in the cases that were reported to the CDC, to the use of e-cigarette. Now, what is an e-cigarette? E-cigarette is, if you look up Juul, J-U-U-L. I'm not singling out Juul, but that's commonly what people know as e-cigarette. It's a small thing that looks like a USB drive. I don't have a sample here, sorry. It's a small thing that looks like a USB drive that you connect to a little bit of a black battery operated thing. The black battery, when you inhale through the small USB drive that's full of oil, theoretically it's only a nicotine, and there seems to be several different components, but one of them that has been alluded to in the CDC report is vitamin E oil. So anyway, when you inhale, it triggers the battery to turn on coils to burn at a very high temperature the oil that's in the little tiny USB thing. And when that happens, the oil vaporizes, turns into a plume of smoke, and you inhale it. And there's nicotine in the oil, And when you inhale nicotine, well, you get the nicotinic response, which is usually a sense of well-being. And you'll usually notice it because you'll see somebody, you're walking along, you see somebody just exhale this plume of smoke. It's ridiculously thick. It looks like a small cloud about the same size as a torso, and it evaporates or disperses within seconds. But it's just so weird to see that. Or if you're driving along, you're driving along at a stoplight, you'll see somebody roll down their window and whew, you'll see all this white smoke come out of their car, all condensed like a little cloud, and they just inhaled it. Now, that can't be healthy. So it reminds me of popcorn lung. In the 90s to early 2000s, if you remember, there was something called popcorn lung. And I always thought it was because people would microwave their popcorn bags and they'd open the bags and all this oil that was heated up would be released, and then you'd inhale it and start coughing. And I think that can be attributed to some of the visits to the emergency room, but popcorn lung, which was something obliterans. I'm sorry, I forget the name. Pneumonia obliterans or obliterans pneumonia. It was because of workers in a popcorn factory all getting sick and having irreversible disease from the combination of the flavors that went into the popcorn that went into the microwave bag. So at that point in time, in the late 90s, early 2000s, I think they changed around I don't know, remember which popcorn company, changed around the formula. They gave warnings on the popcorn bags, do not inhale after you open. And I think it's been quiet since then. But it was because of the oil in the bag being produced for flavoring that caused the reaction to the lung. And that led to lipoid pneumonia, or something that looked like lipoid pneumonia. Lipoid pneumonia is excessive inhalation of fatty byproducts, or fat. And in patients who would go to the emergency room or the ICU, and they would see a lung doctor couldn't figure out what's going on. They got persistent pneumonia, it's not infectious, so why they can't breathe. They would go into the lung with a scope, they'd biopsy the little white blood cells called macrophages, and they'd find that under a microscope they're full of fat. So inhaling a spectacular amount of fat is not a good thing, and that doesn't usually happen. But if it is vaporized, like in the e-cigarette, because that's oil, has a carrier, oil is somewhat stable, it doesn't freeze, it doesn't melt, it stays stable in that plastic container for a long time. If you put nicotine in there and some flavoring, which I don't agree with. I think the e-cigarette companies that are putting these flavors, like bubblegum, and there's weird names to them, they're all marketing, in my opinion, young people. And young people shouldn't be doing this. But if you heat that stuff up, it's going to do something bad to you. It'll deliver the nicotine, which I guess is okay if you're trying to get off tobacco. But if you're just going into entry level and you're doing the nicotine and you haven't even done tobacco, then the likelihood of you going from nicotine to addiction, because it's highly addictive, gives you a great high, but then it drops you. So what happens with that? You want more. I think 21% of teens that start with nicotine inhalation, they continue on to more inhalation later on. So the problem is not only the addictive process of nicotine, but also the contents in the oil. There have been heavy metals that have been found, probably from the high coil temperature in that little battery part. When you heat it up, not only do you heat up the oil, you also heat up the components of that coil, and you inhale everything. So you might be inhaling chromium or cadmium, which is not good. The oil byproducts, vitamin E has always been known as a good antioxidant, but also a pro-inflammatory too. In fact, people who had a history of tobacco use, when they also take in vitamin E by tablet form, they have a higher chance of lung cancer than the people who don't, than smokers who don't take vitamin E. So we've known that for a long time. So anytime I have a smoker, I say don't take vitamin E. And so when the companies put the vitamin E in the e-cigarette little container, that can't be good. I'm not sure why they do that, but maybe it's a stabilizer or maybe it adds flavor. I don't know. But at this point in time, e-cigarettes are bad. In fact, at this point, I would say, here's my summary. No e-cigarettes. If you haven't started e-cigarettes, don't start now. Wait until this has all been investigated, then consider starting. Otherwise, continue on your tobacco as is, or check out like the Sherman, or at least Advocate has a Good Shepherd Hospital in Barrington. They have a really good quit tobacco hotline and a group that has had very high successes. You might want to, that's been always the best. Whether you add on a nicotine patch or Chantix, the results are better when you join the group. So check out Good Sherman, or Good Shepherd's tobacco cessation group. I would not do street, and that was the common theme also, was that when people buy these containers, they fill them up on their own, and who knows what they're putting in there, but there have been some reports of THC being used in the e-cigarette, and there's no details yet, but of the 450 cases that were reported, the CDC said some reports where people also combined THC. Now, I don't know the details just yet, but I'm assuming that young people or the people who use e-cigarettes, those little containers, if they reload on their own, they're probably putting in THC oil, or I don't know what they're doing, and trying to get, if they can't get into a medical dispensary, medical cannabis dispensary, they're probably doing it on their own. So don't reload on your own. Just buy a new batch if you have. If you can't get off the e-cigarette, get it from a reputable dispensary or a dealer, but don't reload. You don't know what you're doing. Even the container could be bad. Or some people have also modified the heat settings, and that's not good either. So don't reload. Don't buy from credible places. Try to keep it simple. I would also say pace yourself. So at a recent party, I put 3 times a day because I just think that should be enough, but I'm not a smoker. Used to smoke in the Philippines, Marlboro, blue labels, that's non-filtered, but I don't do that anymore, obviously, because I was shocked by a young cadaver I cut open, and it had a black lung and a little ascaris worm that was in the lung, so that freaked me out, stopped me. So the idea would be pace yourself. So I've seen parties where some people are using that plume of smoke. They're like puffing like every other inhale, and that's gotta be bad. That's a lot. Number one, that's a lot of nicotine. Number two, that's a lot of oil that's being vaporized and going into here before you push it out into the world. And don't smoke that crap around me or my kids or my family. I'll kick your ass. So the other thing is, if you do, and I put it up here, if you do medical cannabis vape, what I would do, and I always suggest, is that most of my patients work 9 to 5 jobs, so can't really smoke 9 to 5. And the smoking is not meant to just get you high. It's meant to decrease the anxiety, post-traumatic stress disorder, or the pain. So it's just microdosing. So how do you microdose and make it last? Well, you get the oral stuff in. Tablets, like Avexia Relief, 14-to-1. Half tablet twice a day is my favorite. Edibles, gummies, I like Mindy's Kitchen, triple berry, half tab or half a gummy twice to 3 times a day, maybe, as long as it doesn't make you goofy or tired or dizzy or fatigued or have any memory issues. I think that might take the edge off so you can get back and be productive in society. And if you have to vape, then on top of that, you do a little hit either in the morning, sativa, or at night, indica. So if you're vaping like every hour, like some of my patients, God damn it, that's pace. You gotta pace yourself. And I know you might need more because your anxiety is out the roof. But if your anxiety is out the roof, get the true treatment, which is psychotherapy, cognitive behavioral therapy, calming practice, get out of the bad relationship, or get the oral stuff in that gets mostly CBD in your bloodstream, so that when you do vape, the CBD accelerates and jacks up and magnifies the effect of the vape. So you don't have to vape so often. So the oral stuff stays in your system for at least 6, hopefully 12 hours, where the vape gives a little bit of an accelerated response, so it jacks it up a little bit before it falls all the way to the baseline. So that's how I would play that card until the CDC comes up with more definitive information. I think that my medical marijuana users, at least the way I guide my patients, are going to be safe. If you have any problems with shortness of breath, chest pain, difficulty with breathing, difficulty with activity, gastrointestinal problems, then you should be talking to me or your doctor. But if you don't, I think that if we do the plan that I lay out when we first come in here, and hopefully you're still following my guidance, and not some 20-year-old that's a dispensary person. Nothing against my dispensary people, but I know what I'm doing, and I know how the disease process works, and I know how pharmacokinetics works. So follow my good lead first. There's some really good knowledgeable salespeople, but come to me first. In New York, the doctor or the pharmacist at the dispensary has to prescribe and give the dosing. Here in Illinois is nothing. So I don't know. I'm going to push for legislation that says that we doctors have to help guide. The only problem is none of the doctors know what they're doing. So I'm like the only doctor in the western suburbs. There's only a handful of us that actually knows what to do. We'll get more people. So anyway, pace yourself. If you're going to be starting, as far as medical cannabis, I think you're safe. If you have any of those symptoms, you should contact me or your doctor or go to the emergency room. If you are also using an e-cigarette, get off that crap. At least until the CDC has come up with more definitive conclusions as far as what caused all this stuff. And don't microwave popcorn and vape at the same time. So hopefully this gives you, Joe, this gives you a little bit of an idea about the safety of this. I think there's validity to using this. I do not think that e-cigarettes are as bad as tobacco, but if you're reloading, getting crappy stuff, putting your own shit in there, no, you shouldn't be doing that. Get something from a reputable. If you're doing CBD or hemp-based products, get that from a reputable place. I like Entourage Clinical Services in West Dundee. I think Kaylee is excellent with what she does, and she's very picky with what she sells. So that's the other thing. If you're doing vaping of hemp, again, you have to. That's not federally controlled, so you really have to be picky about who you buy from. Research the companies. But at this point in time, hopefully you are not having any problems and you continue on until this becomes more definitive. So put your comments down below about how you have come up with ideas or what you found, and otherwise I'll see you at the next Minute Clinic.